For more, let's bring in Dr. Len Horovitz. He is a pulmonary specialist at Lenox Hill Hospital in New York City. Doctor, thank you for all that you do and for joining us tonight. So
Thanks for having
President Biden
me.
is hoping for a sense of normalcy by July 4th. What needs to happen in order for us to achieve that?
We really need to be vaccinating, hopefully, 70 to 85% of the country in order to achieve the magic goal of herd immunity. If that's possible, and it may well be possible that everybody's going to be vaccinated at least one dose by May 1st. If that happens, then by July 1st, in cases where we need two vaccinations, like in Pfizer and Moderna, we could well have 70 to 85% of the country vaccinated by July 1st, which would be a game changer.
Minnesota became the latest state to significantly loosen coronavirus restrictions. Variants are still out there, and you're a pulmonary specialist dealing with the respiratory system. What are you still seeing on the front lines?
On the front line, we still see COVID cases, mostly in younger people. Most of the people are at high risk, at least in my experience, have really walked the walk. They know what to do. They know to mask up, to wash their hands, to socially distance, and not to gather in crowds. It's the young people, and especially in the states where they've loosened restrictions, that I think we're going to see problems. I can only echo Dr. Fauci's words of this being, as a euphemism, ill-advised, ridiculous, foolish, and I think that in 3 or 4 weeks, as we see what happens when the restrictions are loosened, we may well have a surge or a fourth wave in those states.
And Dr. Horovitz, when you're talking about younger patients, you're talking about people under the age of 60, 20, in their teens. What are you actually seeing?
I'm talking about the 20 and 30-year-old groups, college age, high school age, and young adults. These are the people that feel a little bit invulnerable, or they feel that even if they get COVID, that they'll recover and there won't be any consequences of it. We all know that there's no definite reason that they should feel that. And yet we have people behaving as if it's no big deal to get COVID.
Well, we've also been following what's known as Longcovid. Are you seeing patients return with breathing issues weeks and months after being infected with the virus?
You have to remember that we're only really a year into this, and many people who were first up in March and April of last year to get COVID are the people that we look at from the longest point of view. Patients who've been hospitalized certainly have clear-cut injury to lungs, to kidneys, to brain, to nervous system. And so these patients are more easy to identify as patients who've received a lot of damage from the virus. The other sort of subset of long COVID involves patients who sort of self-identify. They're people who were never hospitalized. They had COVID. They were treated as outpatients, but they report symptoms that are more or less fatigue, difficulty thinking, so-called brain fog, weakness, inability to function. But it's distinct from those patients who clearly have scarred lungs, kidney damage, or myocardial damage, which we see in patients who've been hospitalized. So there seem to be two main groups of these so-called long haulers that the NIH is studying, and we're just at the beginning of really trying to investigate on the cellular level what's going on with these patients.
Well, as you say, Dr. Horovitz, we are still learning so much about COVID-19, not to mention all of the new variants that are springing up. And now that we've passed a year, we've been reflecting on the lives that we've lost, more than 531,000. What do you wish we all knew about this virus a year ago?
I wish we knew how transmissible it was. We didn't know at the beginning that asymptomatic transmission was possible. It seemed as if SARS-2 was much like SARS-1 in 2003. In that particular disease, people who were transmissible were sick. And so they infected the healthcare workers and their family. But it was easy to quarantine and identify those people and control that epidemic so that only 800 people died worldwide, which is still a lot of people, but it's not 530,000 people in one country, as we have here in the United States. Mm-hmm. So if we had known about the airborne transmissibility of the virus, that would really have been helpful in order for us to really insist on the public health mandates that we now know. Masking, which wasn't clear in the beginning. If you recall, in the beginning, we were told that only people who were sick needed to wear masks. We now know everybody needs to wear a mask. Everybody needs to socially distance, wash their hands.
Yes. Dr. Len Horovitz, thank you.
Thank you for having me.